A 22-year-old man is evaluated for abdominal discomfort he has had for past 6 days and fever for the past 2 weeks. He also notes that his right upper abdomen is bothering him. He states that he does not drink alcohol or use illicit drugs. His medical history is insignificant and family history is negative for any liver disease. For physical examination, his temperature is 38 degrees, 104 degree Fahrenheit, blood pressure is 120/80, pulse rate is 102 over per minute, and respiratory rate is 22 per minute. He is alert and oriented. Sclera rectus and hepatomegaly are noted. Laboratory results are as follows: anti-hepatitis A IgM positive, anti-hepatitis IgG negative, hepatitis B surface antigen negative, hepatitis B surface antigen AB negative, alanine transferase aminotransferase 1544, aspartate aminotransferase 1200. Which of the following transcription factors is required for the B cells to differentiate into plasma cells in this patient? The options are: option A, paired box protein 5PAX5, option B, B cell lymphoma 6, BCL6, option C, microphthalmia associated transcription factor, MITF, option D, metastasis associated 1 family member 3, MTA3, and option E, B lymphocyte induced maturation protein 1, BLIMP1. So this particular question, you had to know that which gene is responsible for the differentiation of B cells into plasma cells. So if you read the full form, if you read the acronym and its full abbreviation, B lymphocyte induced maturation protein, BLIMP1, then it is pretty obvious that this is the protein. All other proteins have something else to do with has something else to do with it rather than the B cell differentiation into plasma cells. So the answer is BLIMP1.
Thanks for watching. Please give a thumbs up and subscribe for more.